My name is Dr. Teresia Wangari Kang'ethe. I am a dentist with special interest in pediatric dentistry and orthodontics. I am the owner and practicing dentist at Smiles and Grins, which is on Feruzi Towers, Kiambu Road. And today we're going to talk about dental braces. Braces are orthodontic appliances that are used to correct the positioning of teeth. And when used with other appliances, it can correct the positioning of the jaws, the positioning of the lips, and just generally how the face looks like. Braces are usually of many types, but most people will know about the metallic small appliances that are placed on the surfaces of the teeth. Apart from those ones, we do have braces that are also whitish, they're tooth colored, ceramic braces that are used when patients are a little concerned about the aesthetics of how the braces will look like. We also have lingual braces that are placed on the inside of the teeth as opposed to the conventional placement on the outside of the teeth. All of them whose purpose is just to align the teeth and put them in a proper positioning. We know that the positioning of teeth affects generally how someone looks. It affects how their face, how their smile looks like. So braces are used now to correct and refine the smile, give good positioning of the teeth, give good alignment. We say that anyone who feels as if the positioning of their teeth is not okay can get braces. It can be anyone who feels like their teeth are too far out, or their teeth are too far in, or their teeth are too open at the front, or their teeth that are twisted and turned, or they have teeth that are feeling as if they're too many, crowded in some way. Yeah, anyone who feels that way can get braces. Usually there is an age below which we are not able to do the conventional braces, the metallic or the ceramic ones placed on the teeth permanently. And that happens for children especially, and especially those who still have some baby teeth in the mouth. We do not do braces at all for children under the age of 5 because they still have all their baby teeth in the mouth. Between the ages of 5 to around 12 years old, we have what we call the mixed dentition phase, where you have baby teeth and you have permanent teeth also in the mouth. At that point, there is a form of braces that can be done, but the conventional fixed braces on the teeth is not something you can do at that age also. But now once you're above 12 or at whatever age you have permanent teeth in the mouth, for the rest of the life, or as long as you have healthy teeth, even at 85, you can do braces. The duration of having braces is one of those questions that you can't answer without having seen the individual case, mostly because the alignment usually has 3 phases, let me put it that way. So we usually have the phase where we are correcting any teeth that are turned, any teeth that are a bit too outside, inward, which is the initial phase of alignment. Now, in that phase, it is the fastest phase of the treatment. It takes about anywhere between 6 to 8 months. You should see a very good change. You should see the teeth are now looking as if they're in position, and they're looking more like what you would want to see when the treatment is over. That, however, is just the beginning of the treatment. Usually in the second phase, we have a leveling phase where you're trying to in the first phase, you get the crowns of the teeth, the top parts that you can see. You get them moving into the position that you want. In the second phase, which is what takes longer, is having the roots also move to that position as well. That phase is very unpredictable. It can go anywhere between 8 months to another year. And then we have the final phase where we do detailing. That is where you see maybe one small tooth is out of line here, or it needs a small tweaking here and there. That's a detailing phase. Now, combined, generally, it will take about 18 months to 2 years on average. There are some people who take a shorter time. There are others who take a longer time. Apart from that, it's important to remember that another important phase of the braces treatment is the retainer phase. Now, the retainer phase for adults who've had alignment, anyone who's had alignment done as an adult, the retainer phase will be for life in most cases. The retainer phase for children, adolescents, that will be anywhere around 6 months to 1 year. But for adults, the retainer phase is for life. So it's very difficult to give an exact, my braces will take 6 months or 1 year. No. Thank you for joining us in this discussion. You can book our services at ponea.com. We look forward to engaging with you more in our coming episodes.